The first aid are urgent therapeutic measures that apply to victims of accidents or sudden illnesses until a specialized treatment is available. The objectives of first aid are relieve the pain, relieve the anxiety, avoid the aggravation of the condition, and in extreme cases, if necessary, avoid death until medical assistance is obtained. How to act in case of emergency? First, always avoid panic. Second, avoid position changes until the nature of the process is determined. And third, reassure the victim by explaining that medical help has already been requested. The head should be kept at the same level as the trunk, except when there is respiratory distress. If nausea or vomiting occurs, turn the head to the side to avoid aspiration. And never give food or drinks, much less in the unconscious patient. The first action, the most immediate, should be to provide the patient with an acceptable breathing, to achieve the unclogging of the respiratory tract to avoid suffocation, extracting foreign bodies, solid or liquid, and withdrawing the falling chunk backwards. The second aspect to correct is the one referring to the circulatory system. This to avoid the shock. The heart rate and blood pressure should be assessed. A shock is an acute hemodynamic disorder characterized by an inadequate, general and lasting perfusion of the tissues that endangers life. The characteristic signs are cold and damp skin, cyanotic lips, tachycardia and arterial hypotension, shallow breathing, and nausea. To avoid this, the patient should be kept warm and the infusion of intravenous fluids and electrolytes started as soon as possible. The emergencies that require first aid most frequently are the accidents in which asphyxia, cardiac arrest and cardiac infarction, severe bleeding, poisoning, burns, heat stroke and insulation, fading, coma, sprains, fractures, and animal bites of people.
What do you do when someone's choking? Say you and a friend are out in a restaurant and all of a sudden they start choking. So I'm going to have my friend Hannah come over here. And we're out, we're having a good time, we're eating, and all of a sudden she seems like she's choking. First you ask, are you okay? And oftentimes the international sign for choking is this, okay? They're like, I can't breathe, something's going on. If you're around other people, you want to get them to help you. You want to, if you're in a restaurant or a place of business, have someone, call out for help and have the people help you out. Tell them what you're doing. Don't just attack them because that will just heighten their anxiety and their panic. So what you're going to do is you're going to stand behind them and you're going to wrap your arms all the way around, okay? And you want to try, you find their belly button with your pinky, make a fist, put the pinky on the belly button, then roll it up so your thumb is, the knuckle of your thumb is right there. And then you thrust, you pull it in and up, and I'm not going to do it as hard. In and up until they can dislodge what is in there and they can breathe again. Don't go crazy like in the movies and start slapping their back and like wrestling. Sometimes people get carried away and they want to slap your back and they just end up hurting you. If the person is pregnant or a larger person and you can't get your arms all the way around to where their belly button is, you're going to want to go higher up to where their breastbone is. So say Hannah is pregnant, congratulations. You wrap around, you find their breastbone, and then you just do the same thing, in and up until they dislodge whatever is in their throat and they can breathe again. If the person is so big, if you're a small person and you have a big strapping person with you who's choking and you just can't even do that, you can assist them into doing a self-Heimlich maneuver on a chair or a surface that will get to their diaphragm. You just lean them over and kind of talk them through it. Stay calm. The more panicky you get, the more panicky they're going to get. They're already in a state of anxiety because they can't breathe, which is normal. So if they lose consciousness and they fall to the floor, you're going to lay them down, you're going to roll them over, and then you're same thing. You're going to find the belly button, roll up, and you're going to thrust while they're on the floor until that comes out or until help arrives. Continue trying to do the thrusts and trying to get them to get that out of their throat so they can breathe again, and just stay with them until help arrives.
The cardiopulmonary resuscitation is a life-saving technique that is useful in many emergencies, including a heart attack or when someone almost drowned, even when the person's breathing and heartbeat have stopped. The American Heart Association recommends that everyone, both the people who are around and not professional and the medical staff, start doing CPR with chest compression. The CPR can make it follow the flow of oxygenated blood to the brain and other vital organs, until more definitive medical treatment can restore the heart's normal rhythm. Before starting CPR, note: is the person in a safe environment? Is the person conscious or unconscious? If the person seems to be unconscious, touch or move his shoulder and ask in a loud voice, "Are you okay?" If the person doesn't respond and there are two people available, one should call 911 or the local emergency number and get the defibrillator if one is available, and the other should begin CPR. If you are alone and have immediate access to a telephone, call 911 or the local emergency number before beginning CPR.
What to do when you need to give someone CPR. Now this video is not going to make you an expert or an EMT or a paramedic in CPR. It's kind of just like a review, a thumbnail course. If you really want to know, which everyone should know, I think it's a fabulous skill to have, take a CPR class. They'll run down the whole thing, they'll give you practicals, they'll help you out, they'll let you know what to do and how to do it, and it's a fantastic course. Everybody can use it in their life. But for this video, I'm just going to give a quick overview of CPR. I'm going to have Hannah, my friend Hannah, come in and lay down, and we're going to show you the quick overview of CPR. Hannah, would you lie down? So what you're going to do is you're going to get the person on their back flat, okay? You're going to look for the line between the nipples above on the breastbone. So you go to the breastbone, you can even feel it on yourself. The breastbone, and there at the very end there's like a little triangle there. That's your xiphoid process. You don't want to push on that because that can break off and lodge into the person's organs. So you go between the two breasts, the breast line, and you don't want to rock. You don't want to do this because that's not going to give you the right kind of force. You want to go on top, keep your hands closed on top, and you just 1, 2, 3, 4, all the way to 30. Do quick, and it's going to be quite a bit of force. Don't be afraid to use that force. It's maybe more than you're used to, but you're saving someone's life, so it's worth it. And then you're going to want to give some breaths. So you tilt the head back, you pinch their nose with your thumb and your forefinger, and you open their mouth, and then you put your mouth on their mouth, and you blow in. 1, watch their chest rise out of the corner of your eyes. 2, watch their chest rise. Then you go back to the compressions. And you keep doing that. You repeat it over and over again. 30 compressions, 2 breaths. 30 compressions, 2 breaths. You keep doing that until the ambulance arrives to help your friend.